Thanks to all of you for joining us this evening. We're really excited to be showing you some really cool technology used by our world-renowned famous Ursuline College of Nursing. I'm Susan Delano. I'm the Vice President for Enrollment. And we've been conducting many of these Zoom meetings throughout the months of March and April and now into May. For those of you that can't visit and see things firsthand, this has been a great way for you to become familiar not only with our faculty, but tonight getting a little more familiar the technology that we use in the classroom, as well as kind of going through a live diagnosis. So you'll get kind of hands-on real life experience as to what you might be experiencing in your practice. So to kick things off tonight, I'm going to turn it over to Patricia Sharpnick, and Patricia is our Dean of the Green School of Nursing. So Dr. Sharpnick, you can take it from here.
Welcome. As Susan said, I'm Dr. Patricia Sharpnick, and I'm Dean of the Breen School of Nursing. And I'm thrilled that you've joined us tonight to just see some of the technology and learning opportunities that you will have at Ursuline College. But I want to tell you a little bit first about Ursuline College and about nursing. This year is considered to be the Year of the Nurse and Midwife by the World Health Organization. And yesterday was the International Day of the Nurse, and this month is the celebration of nurses. And given the COVID crisis and all that's happening out in healthcare, no other profession could be more recognized than nursing. We are at the forefront of what's happening in healthcare today, as well as at the forefront of managing this crisis. So one of our graduates is actually going to open the NASCAR racing event here in Cleveland. He graduated from our second degree accelerated program, and many of our nurses who worked at Cleveland Clinic have gone out to New York and to Detroit to assist other nurses in managing this crisis. So welcome to the profession if you are considering this. But if you're looking at nursing, we rank 39th in the country. That means we are in the top 10% of nursing programs nationwide. We are ranked number 2 in the state of Ohio. So that gives you some frame of reference of what we offer here at Ursuline College. Our faculty are incredibly knowledgeable as well as incredible educators in the field. So we look forward to having the opportunity to share with you some of the technology that we have acquired here. And if you choose to come to Ursuline College, you can start with your bachelor's degree and end with your doctoral degree. We have a traditional BSN program, which is your traditional 4-year program. We have a second degree accelerated program, which is a 15-month program. And what differentiates us from other second degree accelerated programs is that all of our students are in what is called a dedicated education unit. That means those students who are in the second degree program have the opportunity to work one-on-one, apprenticed with a nurse from the beginning of the program to the end. We also have our RN to BSN program, which is an online program. If you go to the graduate level, we have master's degree program. We have nurse practitioner programs in acute care, in adult gerontology, family nurse practitioner. We also have certificates in psychiatric mental health, nurse educator, as well as palliative care. We have a clinical nurse specialist program in acute or in adult gerontology. We also have an MSN leadership program that is fully online for those of you who might be looking for something that's not clinically preparing you, but preparing you for a leadership role in administration. Our Doctor of Nursing Practice program is on aggregate populations and leadership. So it gives you the opportunity to really finalize your education in clinical and administrative practice through the Doctor of Nursing Practice. And that program is completely online. I think that you'll find here at Ursuline an opportunity to not just be part of a nursing program, but a community of learners and a legacy of graduates. So I welcome you here. I welcome you to this webinar, And I look forward to Dr. Patton's presentation about some of the technology that we offer you to provide an educational experience that is far beyond any other nursing program in this region.
All right, thank you, Dr. Sharpnack. I'm just catching up on the slides here. My name is Dr. Patton, and I am faculty here at Ursuline College. To give you a little bit of background on myself, my expertise is in critical care, having worked for the last decade in critical care nursing. And I've been teaching at Ursuline now for the past 5 years. I teach various courses in the undergraduate program, which includes the traditional BSN program, as well as the second degree accelerated program and the RN to BSN program. And I'm also the simulation coordinator, which is really why I'm here tonight, because I'm here to talk about some different technologies that we have. You're probably excited to see Hololens, including HoloHuman, HoloPatient, and then I'm also going to be showing you virtual simulation, which is a technology that we are currently using, especially with the COVID crisis that is happening, that has forced us to step away from some of the hospital clinicals and do virtual simulation as a substitution for the time being. So as I talk about these different technologies, I do want to preface and just say that in no way is this a commercial presentation for some of the software that I'm going to show. And the software and the devices are not proprietary to Ursuline College, but these are devices and technologies that we have acquired through various companies to help ensure that we have an ability for our students to learn in an interactive way, and a way that really allows them to collaborate not only with their peers, but also with us as faculty. So the first thing that I'm going to show you tonight is in regards to the HoloLens. And you'll note that I don't have a HoloLens on right now, and I don't have the actual physical device to show you, as those are currently on campus and we're all working remote. But I am going to walk you through what the HoloLens looks like and what some of the programs are that we have for our nursing program. For HoloPatient, this is a new technology that we just acquired in February. We are one of a handful of programs worldwide who have the ability to use HoloLens for our nursing students. As of right now, we use and will be using HoloPatient and HoloHuman, which are two software apps with the HoloLens for our undergraduate nursing programs, primarily the second degree accelerated program and their traditional BSN program. So what we'll do first is we'll walk through a HoloPatient scenario. So what HoloPatient allows us to do as nursing faculty is to show our students various scenarios. These are clinical scenarios that deal with all different areas of nursing practice. So everything from pediatrics to maternal health and adults, acute and chronic conditions. And what it does is it takes, using the HoloLens, it creates a hologram in front of you so that you can see in 3D and 4D and interact with a patient, as well as see all sides of a patient. So you can actually walk around the patient and take a look at their vital signs. So what I'm going to do is go ahead and change screens here for a second and open this up for you. So you shouldn't be hearing any sound right now, but what we're going to be seeing here is we're going to be seeing Jerry. And I'm just going to pause for a moment so we can talk about this together before we go in and see him. So Jerry Reeves, he's a 32-year-old, and he's been admitted to the ER after a mountain biking accident. He has a history of asthma. He's had that for 22 years. He's on different medications for his asthma, and he has no known allergies. Upon admission, you will note that he has a laceration on his shoulder, and that has since been sutured. He's also been given a tetanus shot and a penicillin injection due to his accident. So we are now the nurse. We are getting ready to go in and see him. So I'm going to go ahead and hit play so we can see the first scene. So we can see him. We see that he's doing a little bit of itching on his face. He just said very quietly that he feels funny. We're walking around him. We can see that laceration on the back of his shoulder. As we continue to walk around him, we can see the monitor, which is over to the left. That monitor is showing us his heart rate, blood pressure, his temperature, and his respiratory rate. And if we take a look at that, with our nursing knowledge, we can see that nothing is too out of the ordinary, but that blood pressure is slightly elevated and that temperature is elevated. As the situation progresses, we're going to head into clip 2. So we've had some passage of time now, and now we can see that monitor is still there, and we're noting some differences. We've seen an elevation in the heart rate, elevation in the blood pressure. He's now breathing much more heavily. We can hear audible wheezing. And he seems a little bit fidgety. He's moving around on the table. You can see that his respiratory rate is increased now. Still doing some itching, and he's looking a bit more uncomfortable. And now we'll head into clip 3. So if we take a look at his vital signs, his heart rate is now markedly increased. His respiratory rate has decreased, and his blood pressure has dropped substantially. If we take a look at him, we notice that he almost appears to be drowsy. He's less responsive. He's not agitated and restless like he was. And we're no longer hearing that audible breathing like we were before. And there you can see it almost looks like he's going to fall asleep on us. So as I pause it here, this is just one example of a patient scenario that we would use for our students. And when we do this in person, when we're on campus, each student gets to wear their own HoloLens device, and they are able to see through that device. And if you're familiar at all with virtual reality and augmented reality, just to give you some background on the difference, when you're talking about virtual reality, you're thinking about perhaps a pair of glasses that you would wear. And when you're in virtual reality, all you see is what's on the screen. Whereas mixed reality, which is what the HoloLens offers, allows the student or the wearer to be able to not only see things like you would in virtual reality, but you're still seeing your own space that you're in. So for example, in this image that we were seeing in this video, you noticed that the patient was sitting on an office table and there were chairs, desks, and computers. So that's a real room. And this was filmed by someone who was actually using the HoloLens device and participating in the simulation. The advantage of augmented and mixed reality is that it allows the learner to not only focus on the simulation, but have less effects of visual disturbances and feeling motion sickness. So with this scenario, if we break it down, we would do it a bit differently with students. We would probably break these up with larger breaks in between to really allow a group of students to work together and figure out, okay, what's happening with Jerry? If we take a look at scene 1 to scene 2, In hindsight now, we can see that there was definitely some itching, and there were changes in his breathing pattern, his heart rate, and his blood pressure. As we look now, if we take a look at his vital signs, a heart rate of 150 and a blood pressure of 86/60, we don't have a whole lot of time before Jerry goes into some type of arrest, whether it be a respiratory or cardiac arrest. So what we would work through together, faculty and students, is to determine what happened to Jerry. And if we think back to the initial scenario, Jerry was given an antibiotic. He was given penicillin. And he didn't have a history of allergy, but what we're actually seeing here is an allergic reaction. More specifically, we're seeing Jerry go into anaphylaxis. So we would talk now in a post-conference after the simulation about, okay, what do we do? How do we help Jerry? How do we get him to a more stable situation where we can raise that blood pressure and lower that heart rate and help his breathing? So this is just one example. There are many different examples that we have, and I won't be showing more today, but this is what Hololens looks like for Holo patient. So I'm going to go ahead and switch screens again here and go back to our presentation, and we'll take a look at some other apps that we have. So the other app that we have the ability to use at Ursuline is called Holohuman. And this is an app, again, that only a handful of schools have across the entire world internationally. So we're very lucky, very fortunate to have this technology, and it can help our students as they're learning anatomy and physiology and pathophysiology as it relates to nursing. So I'm going to go ahead and switch screens again here to show you a short video about Holohuman. Taking just a second for my computer to catch up here with all of my clicks.
Get the full 3D experience of a cadaveric dissection without the cadaver. Introducing Holohuman, a companion product to the award-winning Complete Anatomy platform. Learning anatomy? Choose to learn via system or region, then dive in and explore the world's most advanced 3D anatomy models. Discover the anatomy, structure by structure, in exquisite detail. Explore the depths and layers of the human body. Dissect your way through 12 interactive body systems and identify relationships between organs, tissues, and vessels. Learn detailed information about each anatomical structure. Teaching anatomy? Prepare specific views of the body and save as activities for use in your lesson plan. Share these activities with others through a session. All participants see what you see, following along as the lesson is mirrored on their device. Identify, isolate, and remove structures in a virtual dissection. Students can be challenged to take control of their own learning by flipping the classroom and passing control of the lesson to them. Pearson and 3D for Medical are ready for you to experience the most advanced and exciting mixed reality anatomy product on the market, Holohuman.
So that is Holohuman. And as you saw in some of the images within that video, there's really a lot of great technology within this app and a lot of things that we can do with it to help students learn anatomy. Anatomy can be one of the most difficult courses, whether it's in an undergrad program or in a graduate program. And the purpose of using Hololens and of using these apps is to allow for collaboration. It should be done in groups. So you notice there how there were multiple students around a table as well as a faculty member. And they were able to get up close to the different organs and to the different systems of the body and isolate and see various structures such as bone, muscle, and nerve. And you can do that with all areas of the body. So as you're learning in an anatomy course, if you're focusing on musculoskeletal one week, you can be focusing on that musculoskeletal system and see it within the app. There are many programs that use cadaver labs, not as many anymore because it's hard to obtain human cadavers to learn anatomy. And not to mention, when students are learning with a cadaver, there's only one cadaver. And once you remove an organ or you've studied an organ, the organ is already used. Whereas here, for resource allocation, we can use this over and over again. You can go back and review something if you weren't sure if you saw it right, or you just aren't sure if you're understanding it. And so it really helps students to make sure that they're understanding all of the pieces and parts related to anatomy and to human structure. I'm going to go ahead and go backwards again here to our presentation. So the other item that I wanted to show you today is called vSim. And vSim is separate from Hololens. So this is something that we can use virtually, whereas Hololens is something that we use predominantly in person. We are able to share and use videos like we just showed with Jerry and that case study, but otherwise Hololens is best used in a person-to-person, face-to-face scenario where you can actually wear the lens. vSim is a technology that we can use remotely and students can use remotely, and they can learn independently with the vSim. This is a product that is by Wolters Kluwer in conjunction with Laerdal, which are two nursing learning companies. And it really helps us to show our students different simulations and scenarios and allow them to think through the process similar to how we did with Jerry a few minutes ago to determine what's going on and what do we need to do to treat the patient. So I'm going to open up a new window here to allow you to see what it would look like.
While Lauren is opening up a new window, I'd like to invite all of you to post any questions in the chat room, the chat function on the bottom of your screen. And at the end of our presentation, we'll be able to answer your questions.
So what I have open here now is the vSim platform. This is a program that I use in my critical care course, and we use it right now every week, every day. Our students are active in this program, and it's really helping them to learn because right now with COVID, they're not able to be in the clinical setting. So I'm going to go through and show you some of the different cases and some of the features that we have with vSim. So as I scroll down, since I teach critical care, the screen that you're seeing is related to medical surgical patients. So these are adult patients that might be admitted to an intensive care unit or that might be found on a medical surgical area in the hospital. As I scroll down, you can see they're divided into different sections. We have medical patients. And as I scroll down further here, we have 5 of those. And then I have surgical scenarios. So these patients at the bottom are post-op patients who've had some type of procedure done. So what I'm going to do is just open up one patient here to look at. So we're going to click on Carl Shapiro. So our students have access to this platform, and this is what they use to work through some of their current clinical assignments. And some of the nice features about this as students are learning virtually and remotely is we're able to really tie together the lecture piece or the didactic piece with the clinical piece. So in here, we're given a short synopsis about Mr. Shapiro. I won't read it all off to you, but he's a 54-year-old gentleman admitted to the ED with chest pain. So he's in the emergency department, and he started receiving treatment for his chest pain. He's gotten some pain medication, oxygen, and some medication to help relieve some of the chest pain. And it ties in what the students are going to be seeing here in a few minutes in the simulation with their textbook. So before they go in and they do a virtual simulation, this helps to ensure that they've done the reading and they are ready and prepared to be successful in the simulation. It also tells them what things to review before they jump in, such as tests and medications. And then before they start the actual virtual simulation, they take a pre-test or a pre-quiz, and then they go in. So let's go to the exciting part and click on vSim. And I'm going to go ahead and launch the simulation. So as I open up the simulation, it's going to take a moment here to load. We're seeing again that synopsis about Mr. Shapiro. And we're going to hit to go see him. So now that I've selected to go see the patient, what you're seeing in front of you is you're seeing his electronic health record. So again, we have his synopsis. We have some information about his wife, Nancy, over here in the corner. Information about marriage status, religion, occupation, and race, just like we would see in a hospital setting. And if we look at the tabs that are flashing, I can see that's letting me know that there's new information there. So what we have here in this tab, called diagnostics, we're looking at lab values. So just as our students would be expected in a clinical setting, they need to look through the labs to be able to determine what's normal, what's abnormal, and what do I need to flag in the back of my head to help care for Mr. Shapiro. If we click on medication chart, we can see the medications that are currently ordered. We can see the dosage and how often they should be administered. And we can also check with his orders to see what all the physician or the nurse practitioner has ordered for him. So we're going to go ahead and X out of his medical chart and go in and see him.
Dan, I'll be your primary nurse today.
You'll notice that you will be hearing some sound. The nurse is interacting with the patient. And now as the student, we have control over what the nurse does. Just like we would in a clinical setting, it's up to us to make decisions and to choose actions. And then we will see how the patient responds. Virtual simulation works similar to simulation in person, where whatever we do, the patient is going to have a reaction. If we make the right choice, the patient gets better. If we make the wrong decision, the patient deteriorates and gets worse. So let's just start and do a couple things so you can see how this would work. First things first, we're going to identify the patient.
Please state your name and date of birth.
My name is Carl Shapiro. I was born on July 19th, 1965.
Okay, so we check to make sure
Everything
it's the
matches.
right patient. And now we can choose what interventions we want to do. So let's go to assessments. We can go to vital signs and select which vital signs we want to obtain. We can check his blood pressure, check his oxygen saturation. So I'll just click one of these here.
This is a pulse oximeter, which monitors the oxygen level in your blood. It fits snugly around your finger, but should not hurt.
Okay.
If we take a look at the bottom now, we can see that we now have his oxygen percentage. And we could go ahead and continue to obtain whatever vital signs we think are pertinent at this time. I will go ahead and tell you now what happens to Mr. Shapiro if we were to continue the simulation. It lasts approximately 15 to 20 minutes. The patient scenario continues to unfold. Here with chest pain, he is having a heart attack. It's up to us to figure that out before it's too late. And he does go into cardiac arrest. So what the students have to do in this scenario is to initiate chest compressions and defibrillate the patient to bring him back to life. Once a student is finished with the simulation, once they've gone through, they will go ahead and hit patient handoff report down here, and that will end the simulation. There are other features within this technology where you can call a physician or call a nurse practitioner, and you can also go back and access that electronic health record to see what labs may have come back. So we'll go ahead and just hit patient handoff. It's making sure I really want to end because I didn't spend very much time.
We should treat this patient a little longer before handoff.
And once the student is finished with the simulation, of course, they're going to do a much better job than I did within the last couple minutes, but they will get a percent or a score. So down here, oh, we got a 3%. But what we make all of our students do, our students are required to meet at least a 76% threshold. And the idea behind the virtual simulation is that students take it over and over again until they obtain that 76% or higher. The great thing about this technology is it does give a transcript, as you can see here, and it tells me my areas for improvement so that I can understand what I didn't do correctly, and I can go back and improve upon it the next time. In addition to just having students complete the virtual simulation, we also encourage and hold different meetings, like Zoom meetings. Just as we would in a clinical setting of doing post-conference, we do that virtually with our students to talk about the case and talk about how it might vary from what you could see in a clinical setting and how to build upon that knowledge and understanding that they've gained from the scenario that we went over that week. I'm going to go ahead and switch screens again here. So that was vSim. So those are the technologies that I wanted to share with you today. And we'd like to go ahead and open it up for questions and answers.
And we unmute. Okay, this is Susan again. Thanks for spending time with us to learn more about Holo Human, Holo Patient, and vSim. I found it fascinating. I hope you did too. Don't forget, you can post any questions you have about the nursing program or about the technology in the chat function. And I'll be able to address those questions to either Dr. Schnick or Dr. Patton. But the first, this will be for Dr. Sharpnick. Can you talk a little bit about what programs you offer online?
That we offer online is our RN BSN program, which provides the opportunity for practicing nurses to obtain their bachelor's degree in nursing, which is required by most healthcare organizations today. An additional one is our MSN in leadership, and that was requested by many of our practice partners out in the community. They were looking for an opportunity not just to have nurse practitioners prepared to be functioning in our healthcare systems, but to provide an opportunity for leaders who wanted to work at an administrative level to have the education that's required to function well and to help our healthcare organizations be high reliability organizations as well as be successful. And third, our Doctor of Nursing practice program, which is again at the doctoral level, and it really prepares practitioners, educators, and administrators to function at the highest level of clinical practice and administrative practice. So all three of those programs are offered in a robust format online and are available to students at various levels. Our other programs, although they're face-to-face, do have some online options in their coursework, but for the most part, they are face-to-face.
Great. This question will be directed to Lauren, and let's see, I lost it. Can you define how the technologies are used for each of the programs? So what is used in the graduate program and what is used in the undergraduate program? Oh.
Sorry, I was muted there. So right now, having just received the HoloLenses back in February and then being taken off campus in March due to COVID, the current plan is to integrate HoloLens. So that would be Holo Patient and Holo Human beginning in August, once all of the faculty come back to campus from the summer. And we are currently evaluating, along with our graduate faculty, what role Holo Patient and Holo Human could have in the graduate program. So at this moment, it is not integrated in that program. but we are working too with the software engineers, GigXR, which is the company in charge of the HoloHuman and HoloPatient, to get them to have more advanced scenarios for nurse practitioner students. Right now, the scenarios that exist, for example, Jerry that we went through, is really at more of the undergraduate level. So we're waiting for them to release new scenarios. They are working on it. Exactly when they will be released, I'm not sure, but we are hoping to begin to use that in the graduate program too. The vSim, the virtual simulation, is currently only in the undergraduate program. That would be the traditional BSN and the second degree accelerated program.
Good, thank you. This question is from Ben, and I'm going to direct it to Pat. Will the lack of in-person clinicals due to COVID affect employment opportunities for graduates?
Question. Right now, no. Actually, our practice partners are looking forward to having our graduates join their teams as soon as possible. In fact, we've worked with our practice partners at both Cleveland Clinic and University Hospitals, as well as the VA in Cleveland and Metro Health, to ensure that their education is that their orientation is definitely adjusted so that they have some additional time to be acclimated to the clinical practice. Now, understand we are planning to go back into clinical practice as of June 1st. The clinical agencies have all opened up their areas on a moderated level, but we are looking forward to being back in that clinical area. But at this point in time, we have worked very hard with our practice partners to ensure that our students not only transition well to practice, but are supported in a way that enables them to be successful.
Good. This question is from Isabella, and Lauren, if you can answer this. In what year do we get to use this equipment?
Yeah, that's a good question. So our plan is to integrate throughout the entire curriculum for undergraduate students. So if you're in the second degree accelerated program, or if you're in the traditional BSN program, this would be your first semester of nursing courses. In that first semester, you take pathophysiology and you take some of the fundamental nursing courses, and that's when you would start using the technology, but you would continue to use it throughout the program as well.
Good. And there is one last question from Cole. How do you think the skills learned during these programs would translate into the real world? And I'll leave that open for either Pat or Lauren to answer.
I can take
that one.
Yeah, there's been a lot of research in simulation in general and virtual simulation. And what we're seeing from the literature within the research is that when we think about the cognitive skills, the students are able to take away the same level of cognitive awareness, or if you think about it, the level of thinking, the know-how, from a virtual simulation and a simulation as they can a real clinical scenario. And so that has allowed programs to really build more simulation into their programs and into their curricula. But we do have to keep in mind that a virtual simulation doesn't help students with their kinesthetic skills or their hands-on skills. So knowing how to put in an IV, or how to place a urinary catheter and how to change a dressing, we can watch videos on that. We can gain knowledge on how to do it, but it doesn't help students feel confident in their ability to actually go in and then do it. So what we're doing, although nursing programs right now are having to rely on virtual learning for clinical, we are giving our students the opportunity, once we're able to get them back on campus, to have extensive lab practices, as well as lab checkoffs and opportunities within clinical to make sure that they're confident and competent in those physical skills.
Okay, Lauren, here's another question from Stephanie. Would the person be stationary or movable for each person?
I think you're talking about Hololens here, as far as the hologram patient, of whether they're stationary or movable. So it depends. If you're using HoloLens individually, you get to move them. You can pick your patient up and move them to a different table or set them at a different angle. If you're in a group, there's always one host, similar to in a Zoom meeting, how there's a host who's controlling it. So that might be a faculty member, or that might be a student within the group. And then all of the other students join the group. So that way you're looking at the same patient.
And Pat, the question is the graduate program just for a master's in nursing, or is there anything else that we offer?
Well, graduate nursing includes both the master's and the doctorate. The master's degree is focused pretty much on the nurse practitioner role, or as I mentioned before, the administrative role. So it is both. Those are the only two we have right now. We do offer a master's degree in nursing education, or a master's degree as a nurse practitioner or leadership with a subclassification in either palliative care or nursing education. But when you're looking at nursing education, it's on building blocks here at Ursuline College. Your first level is the Bachelor of Science in Nursing, and that's a 4-year degree, or if you're in a second degree program, it's a 15-month degree, or if you're in a BSN, it's a shorter time frame. However, that is what we consider the basic for going out to practice in the healthcare field. And research has shown that the bachelor's degree prepared nurse is a much better prepared nurse in terms of providing safe and quality patient care. So that is why most of our healthcare systems require that bachelor's degree as the minimum entry level. The next level that you build on is the Master's of Science in Nursing. And that level either goes to the nurse practitioner, a nurse educator, or clinical nurse specialist, or it goes to a nursing degree in leadership. And then your next level is the Doctor of Nursing Practice, or a PhD in nursing. One is focused on the clinical role or the administrative role with an option for becoming a faculty member. The other is focused on the nurse scientist role or research role. So those are the levels for nursing practice as we look at them currently.
Right. And we offer the DNP at Ursuline, not the PhD.
That's correct.
Okay, Pat, I'm going to lob this one to you. Should we expect in-class lectures and clinicals for the fall semester?
I will tell you right now, we're hoping to have all of our clinical practice in place starting June 1st. We are all at the mercy of this pandemic and have to wait for our practice partners to open up these clinical sites and to provide these opportunities. But know that our practice partners, all the assistants in Ohio, are very committed to getting student nurses back into the clinical area. So I believe that we will have clinical experiences. As far as face-to-face classes, we're hoping for that. I mean, right now we are planning to have some form of face-to-face. It may be modified, it may be a little bit adjusted, but we know how important it is for our students to be in a situation where they are face-to-face and having the opportunity to interact at that level with our faculty. So our goal is to do that. Again, depending on our governor, depending on the state of this pandemic, we will pivot as best as we can to meet the needs of the students. I will let you know that despite the fact that we went online quickly this spring, that I have received more feedback from our students that the rigor of the programming and the education that our student nurses receive has been exceptional. In fact, I received from students that are graduating that they felt like there was nothing missed aside from the clinical experiences. So our faculty is well versed in managing the classroom, whether it's in an online environment or a face-to-face environment. So I can assure you that what you'll get is a quality education, and you will have the opportunity to have many of these technologies integrated into that learning experiences at all levels, whether you start at the baccalaureate or you go to the doctoral level. We are very committed to ensuring that your education is not just quality-based, but it focuses on the fact that we want you to be safe practitioners at the completion of the program.
Yeah, and I'll take one last question before we conclude, and the question is from Heather. Can you explain the difference between CNS and NP roles?
Yes, I can. The clinical nurse specialist really does deal with populations. The nurse practitioner really deals with specific patients and a specialty area. So, for example, a nurse practitioner in our programs is either an acute care adult gerontology nurse practitioner, and that means she takes care of any kind of patients that fit within that category. So anyone from 18 and above who is in acute care situation, that is in acute situations in terms of healthcare. We also have an adult gerontology, and that's a primary care-based nurse practitioner. And that's somebody who takes care of patients similar to a family physician. We also have a family nurse practitioner who takes care of patients all the way from infancy to adulthood. And a psychiatric nurse practitioner who could take care of patients from infancy to adulthood with mental health or dual diagnoses. That is, those who may have a diagnosis of substance abuse and or psychiatric mental health conditions. A clinical nurse specialist, we have one track here, and that's adult gerontology. And it really is dealing with a population. And so what clinical nurse specialists usually do is deal with clinics. For example, they work for the Cleveland Clinic and they're dealing with a congestive heart failure, more specific clinic related to a population of patients with a specific diagnosis. Clinical nurse specialists often tend to be educators in hospitals related to a specific diagnosis. So a little bit different in their approach. We see, for the most part, that the demand for nurse practitioners is much higher than for clinical nurse specialists. So most of our admissions and requests are for the nurse practitioner role.
Okay. Good, thank you. Lauren, if you can advance, I think there's one last slide for us to conclude. I do want to thank everybody who joined us this evening. I learned a lot. I'm sure you did too. And I especially want to thank our faculty, Dr. Sharpnick and Dr. Patton, for joining us and taking time out of their crazy schedule to spend some time with you today. Just as a reminder, stay in touch with us. Keep looking back at our website where we post new events. We continue to add them. I know if you're on our email list, we'll continue to send you updates on things that might interest you. And if you have ideas of things that you would like us to offer, there's my email and Dr. Sharpnick's email. So please make suggestions, and we're happy to spend some time educating you on whether it's what Ursuline is up to or in the field of nursing or whatever other ideas you might have. So thanks again, stay safe. Hopefully we'll be opening campus up to visits on June 1st. That's our plan. All things go well. So keep checking our website and you can come visit and meet us live in person. All right, take care everybody. And thanks again. Have a good evening.
Thank you. Good night.
Thank you.